Hello, Rockdale. Sean Kimball here with your weekly COVID-19 report. Georgia has had 13,827 more cases and 631 more deaths. And in Rockdale County, we've had 98 more cases and 2 additional deaths reported since last week. Our co-host, Dan Morgan, is joining us again to update us on some new information. Dan, what you got for us?
Well, Sean, we have a couple of big news that happened since we last talked last week, and most of it happened very, very recently. I'll work backwards. As of yesterday, Thursday, the governor announced an expansion of those eligible for vaccines in the state of Georgia. Very exciting news. And these changes will become effective March the 8th. But if you're in one of these groups, you can go now and pre-register on a state site if you're interested in getting a vaccination at one of the 4 state mass vaccination sites, and there is one here in Atlanta. I'll go over those addresses in a second. But the new eligible groups are educators, teachers, staff. That is everything from pre-K, including daycare centers, through 12. That is a big one. And then there's adults with intellectual and developmental disabilities and their caregivers. And then parents of children with very complex medical issues. The children themselves are not eligible because there is not a vaccine for children yet. But the children with complex medical issues, their parents, their caregivers are now eligible to go sign up to get the vaccine. So that added 3 major groups of people to the already existing first responders, healthcare workers, and people who live in assisted living, and everyone 65 and over. So the group is expanding. That is good news. That also means that vaccines are still tight because the demand, the governor was very clear on this, that the vaccine demand will still outstrip the supply, even though our supply, good news, is continuing to increase. The supply to private providers, the Walgreens, the Walmarts, the Publix, the Krogers, the CVSs, that is also increasing. You can go to those providers' sites directly and sign up for a vaccine. Also with the vaccine, today is Friday. So over the weekend, the FDA is scheduled to do the final approval on the Johnson & Johnson single-dose vaccine. And when that becomes available, they will start shipping it. That will give us a third vaccine. It's a little different, but it's still a third vaccine that will help increase the supply to reduce some of that scarcity right now. So that's the big thing. On the governor's announcement, the 4 main sites, these are very large drive-through sites. It's about 1,000 to 1,500 people per day that are on there. And let me give you those cities that they are in. They are in Atlanta at the Delta Air Museum, down in Hateville, just around the airport. There's one in Albany, there's one in Clarksville, and there's one in Macon. And if you go to My Vaccine Georgia, and you have to spell out the word Georgia, myvaccinegeorgia.com, you can see where these are, and you can actually pre-register to get a vaccine at one of these 4 locations. So it's very clear that site is only for these 4 large state-run sites. You still have gnrhealth.com for the local health department sites, which are in Gwinnett County and Rockdale County at Springfield Baptist Church, to sign up through that. Then you also have all the private provider sites that you can go to a store to get yours if they have them available. So very large changes of availability and new people who are eligible, new places to go. So it's been an exciting week.
Is there a cost to these vaccines? Because you said things like CVS and Walmart and stuff of that nature. Is there a cost when you're dealing with the private sector, or is all the vaccines free?
That is a great question. And 100% the vaccines are free. You go to the health department, you go to the state site, They may ask for your insurance card, but that is only to back bill the insurance if somebody has it for the administrative cost of supplying and setting up and administering the vaccine. The actual vaccine, the drug itself, the government has already purchased, they are free. The same thing happens in the Walgreens and the Walmarts is they would want, if you have available your proof of insurance, they're not going to turn you away if you do not have it. But if you do, they're going to try to recoup some of their cost through the insurance. It's like going to the doctor. You have insurance, there is no copay, but they're going to bill the insurance for the administrative cost for that doctor visit. But in this case, the vaccine itself is free. So cost should never be a barrier because there isn't a cost. It's either totally free or free to the consumer with a small charge back to their insurer.
Remember to wear your mask, social distance, and wash your hands frequently. I want to say thank you to our EMA director and co-host, Dan Morgan, for joining us each week. That's all for today. I'll see you next time right here on Rockdale 23.